So I'm Dr. Jonathan Williams. I grew up here close by in Davis County. I'm a pediatrician and I'm working at the Davis Family Physicians location in Layton. So I chose pediatrics, really an easy choice for me. Really, I think it's the only career I've ever actually considered. It's not 100% true. I used to want to be a clown. I wanted to be a clown when I was in preschool, and then some preschool teacher told me that clowns isn't a great career choice, which I thought was a mean move to a 4-year-old. And I was devastated, and because I was going to be a clown, I was going to make everybody happy, and I was going to fix people's bad days, and this preschool teacher just dashed all those hopes. And I remember being devastated. I was laying on the floor in my front room, just so sad, and I just didn't know what I was going to do with my life. And I don't know if it was that day or a couple days later or what, but I had a doctor's visit with my pediatrician. He made me laugh, and he made my mom's day better, and it just stuck. So I've wanted to be a pediatrician ever since then. So my approach to patient care, you're going to see I'm very patient-centric, right? I'm going to walk into that exam room and I'm going to talk directly to that 4-year-old before I even really acknowledge the mom in the room, right? I'm going to show that 4-year-old they're kind of in charge here. You're also going to see me really loop in parents when it comes to treatment plans. That's one thing that is really fantastic about pediatrics is it's an entire family that you're focused on. There's a lot of things in pediatrics that I can't fix that kid unless I have mom and dad's support. So it's important to establish care with a pediatrician because kids are really subtle, right? They're tricky. A few years back, it was a particularly bad RSV season, and all we were seeing was just kids with RSV after kids with RSV. They came in, they're having difficulty time breathing, and the presentation was all the same. I remember seeing an 8-week-old, maybe a 6 to 8-week-old during that time presented the exact same way, just having a hard time breathing. Parents were of course very concerned, and I think maybe this kid had already been diagnosed with RSV or been told they had RSV from someone else. Something was uncomfortable about that kid, and we dug a little bit deeper, and he was in congestive heart failure. Kids are really, really subtle. It's easy to miss a subtle, missed developmental milestone in a 6-month-old, right? It's hard to pull out a history from a 3-year-old. And those are the things that pediatricians are specialty trained in. So the most rewarding part of my job is obvious, it's the patients. I love the variety, I love the kids. It's really difficult to have a bad day as a pediatrician. You know, some kid will say something hilarious or will do something completely unexpected. And the patients are what makes my job satisfying. It feels like an honor taking care of, the best part of our population.